Hello everybody, my name is Dr. Ibrahim Khan. I'm a family medicine practitioner with Lake Region Healthcare. This is the second series on lifestyle modifications on anxiety, and this is going to center on personal activities. There are three types of personal activities that I think that we could modify, or at least start with looking at. One is exercise, getting proper exercise. Two is pleasurable activities and hobbies that I think that we should always engage in. And three is social activities and boosting them. So let's go into it one by one. So exercise. There's a number of research articles that have come out that have explained and documented the importance of exercise, not only for cardiovascular health, but also for mental health. It boosts cognitive ability. It definitely combats anxiety, depression, and other mental disorders as well. It boosts endorphins. A lot of people comment that if their healthcare provider has suggested a medication, they don't want to change the hormone levels or chemistry in their body. So this is a way that you can kind of play with that yourself, where you're boosting your own endorphins and really kind of helping to treat your anxiety. So regular exercise is definitely prescribed. It's a good thing. Getting a good amount of cardiovascular exercise, that's going to increase your lifespan and your cardiac health, and then getting weight resistance exercise, that's going to increase your quality of life. I think it's going to be really good things. Obviously, you're going to check with your healthcare provider before doing any of these because you may have limitations to those two activities, but exercise in general, great way to combat anxiety and boost endorphins in the body. The second thing is pleasurable activities. We all have a number of hobbies, reading, gardening, art, yoga, music, maybe hiking and going into nature. Whatever your hobby is, I think that you should do it. I always tell my patients and even my family and friends, you should take some time for yourself at the end of the day, even if it's like 10, 20 minutes, even 5 minutes if you have it. Just take some time for yourself to do some pleasurable activity and then make time throughout the week. It's going to be really good. There's a lot of studies, again, that come out that have come out, that have suggested that increasing these pleasurable activities, doing those hobbies in your life, that's huge for combating your anxiety. So taking some time to maybe play that music or do some art projects around the house or whatever gives you pleasure is going to be a great thing to add in your life. Nature specifically has been in research that going out into nature is very, very soothing and can combat anxiety. There are some people that are actually prescribing going out and taking daily walks as a way of combating anxiety too. So going through those pleasurable activities is going to be a good thing. Reading is another one. A lot of studies show that your anxiety goes down, particularly at the end of the day, muscle tension goes down. It's a great activity to do to wind out the day as well. The final thing that I wanted to talk about is social activities. So if we're not making time for our partners, our family, our friends, I think we're really missing out on one of the major aspects of life. There's a lot of research that shows that the more you do that, the more you boost endorphins and you boost oxytocin. This is a great way, again, of combating your own kind of chemistry in your body and really helping to treat your own anxiety and decrease your anxiety and other mental health disorders as well. But the more social time that you can get, I think the better. Obviously, if you're an introvert versus an extrovert, you have to kind of manage that. If you need time to yourself, definitely take time to yourself. But having a good social life where you have regular interactions with your partner, your family, and your friends is going to be a great way to treat your anxiety, boost the amount of endorphins and oxytocin in your body, and kind of combat some of the feelings that you might have, some of the likelihood that you might experience anxiety, particularly in stressful situations. I hope these three interventions have really helped addressing the personal issues from these three categories. Check with your primary care providers as always. Thank you so much for your time.